Welcome to my physical activity intervention program presentation. First of all, I'd like to introduce the participant that undertook the study. She was a 48-year-old female who was somewhat active in her day-to-day life. Now, her main sources of physical activity included a swim for 30 minutes each week. She would also walk to the shops, which were about 10 or 15 minutes away from her home. And she would also walk her children a short distance from the car to and from school. She also undertook household activities, as well as taking the children to the park on the weekends with her husband. Now, the data collected was via a wearable fitness tracking device, and what we needed to collect was heart rate, so we could look at the intensity of the exercise that she was undertaking. We looked at also steps that she took each day, and this was to look at the volume of activity that she undertook, and also the active minutes per day. She was also issued with 2 7-day international physical activity questionnaires, which she would complete at the end of each week, detailing the activity that she undertook. She was also issued with 2 7-day physical activity tracking worksheets, and this was to collect data on the actual physical activity that she undertook, also the duration of that activity and the intensity of that activity. So with the data collected, we ascertained that she was swimming once a week for about 30 minutes, and we needed her to calculate her heart rate so we could determine the intensity that she was exercising under. Now, she wasn't able to wear the wearable tracking, the fitness tracking device in the water, so we needed her to palpate her heart rate. And to measure the heart rate, we needed her to be within 50 and 70% of her maximum heart rate, which we calculated prior to her swimming. And so she was actually able to meet the moderate intensity during this swim, but she was only doing this once a week. So based on the steps that she was undertaking each day, that put her into the somewhat active category. Now, the recommendation is for 10,000 steps per day. The other information that we gathered was that the participant was not engaging in any muscle strengthening or resistance training exercises. She was active on most days, but this was usually due to light or some moderate intensity exercise. And the recommendation is the accumulation of 150 to 300 minutes of moderate activity each week. We also looked at the type of exercise that she was doing. So using the Metcode compendium, we could calculate the level of activity that she was undertaking, and so we needed her to gain a minimum of 500 minutes per week. So looking at exercise goals, the participant identified some of her goals as increasing her VO2 max, so trying to improve her her cardiovascular fitness, improving flexibility, and this was specific to some stiffness that she experienced on occasions in her lumbar spine. We also looked at improving her muscular strength and endurance, and this is also to help reduce the risk of chronic disease. So the recommendation is that a person should be, or an adult should perform muscle strength and endurance training for a minimum of 2 days a week, which she wasn't gaining at or wasn't participating in at the time. Another goal was to also improve mental health as well. So looking at her current life, she's currently studying as well, and she's doing one evening a week at her local university, and she's hoping that the exercise would actually help to improve her coping ability as well. So it's also stated that at least 20 minutes a week, that's all we sort of need of physical activity, will benefit a person's mental health, but also help to lower their psychological distress. So you only need about 20 minutes per week of exercise. So it also shows that participating in exercise can actually have a substantial impact on a person's well-being, as well as on the public health system as well. So it can help to improve their quality of life, but also reduce the risk of chronic disease. And it also states that people who are regularly physically active are less likely to develop health problems than those who are sedentary. So physical inactivity is a modifiable risk factor and for many chronic diseases. And so it's shown that the long-term effects of physical activity can be a positive influence on the management and the prevention of many chronic diseases. So when we looked at this person's 12-week program, what we're looking at the person's goals. And so we're looking to increase the cardiovascular exercise. So we started off by having the person participate in 3 times a week and going for about 20 to 30 minutes and looking at a moderate intensity. So either using RPE or rate of perceived exertion score or having a range of 50 to 70% of their maximum heart rate. So for the first 2 weeks, this was being achieved, and then we're looking at increasing that to the 12-week mark of the person participating in exercise for 5 days a week for 30 to 40 minutes, but we're looking at increasing the intensity as well as the time of exercise. So we're starting off with only 3 days a week, but the goal was to get to 5 days a week. So some cardiovascular exercise that we could incorporate would be things like swimming, which was something that she enjoyed doing, brisk walking, jogging, or group fitness session, which she would undertake, but not on a regular basis. So if we looked at resistance training, which is something that she wasn't undertaking, that we can look at looking at how to incorporate resistance training into her program. So we're starting off with 1 to 2 times a week, and we're starting off with body weight training, so body weight exercises. Then we would progress from body weight to resistance bands and weighted exercises as well. And the first few weeks we're looking at full body sessions, and then we could split those sessions into upper and lower body as well. So we did that for a few weeks, and then we could look at bringing it back to full body training and incorporating a whole range of different exercises. So incorporating some body weight, some resistance bands, some weights, machinery and things like that as well. So other types of resistance training, as I mentioned, body weight exercise, resistance band exercises, weighted resistance exercises, so dumbbells and barbells, etc., machine weight, suspension training, and any other resistance training equipment that we could use. Now, flexibility again was something that was important to her as one of her goals, and so we looked at consciously looking at doing some flexibility twice a week. Now, we wanted to increase that from week 1 all the way down to week 12, so we could incorporate some some flexibility exercises on a daily basis. So starting off with a couple of times a week to a daily basis. So some flexibility would incorporate static stretches, dynamic stretches, some P&F stretches, and even things like Pilates or yoga. So the first strategy that we need to put in place is to determine any barriers. So things like from personal characteristics, we need to look at things like self-motivation. We also need to look at the environmental characteristics, so family support. Does she have access to facilities and resources? And also we need to look at the activity itself. So now that we've determined any barriers to exercise, we need to start to plan. So planning her sessions and also setting some specific goals. We need to provide some education, including things like the benefits of resistance training, as well as any risks that are involved in exercise. Keeping her motivated, so making sure that she's undertaking exercises that she enjoys, and also this can help to improve the compliance of the program. Putting some strategies in place for any non-compliance, so if she does fall away from the training, then we can get her back on track. Slowly increasing the duration of the sessions to allow her to reach her goal. Providing some reward system, so if she reaches some specific goals, then we can reward her somehow. Also providing some fitness testing, and this can help to keep her on track. So here are some references that I used throughout this presentation. Thanks for listening.